Have you ever stopped to think about what actually happens the moment you are discharged from the hospital? I mean, you walk out those doors, and sure, your physical healing journey continues at home, but an entirely different, totally invisible, and incredibly complex journey has just kicked off for your personal medical data. We so often think of healthcare as just doctors and nurses at the bedside, right? But there is this massive hidden engine working around the clock to process, protect, and utilize every single detail of your visit.
So to really get how this engine works, we need to ground ourselves in a dense but absolutely crucial academic concept: health informatics. Our source material defines this as an interprofessional specialty that exists right at the crossroads of three major domains. We're talking health, information science and technology, and social and behavioral science. It's the vital practice of using data not just to pay the bills, but for scientific inquiry, problem solving, and, frankly, making healthcare delivery safer and much more effective for all of us.
All right, let's dive into the whole shebang. Welcome to This Explainer. Today, we are taking a macro to micro journey into the systems and the specialized professionals guarding our healthcare data. We're going to explore the fascinating world of health information management, or IM for short. We'll look at the tools they use, the software that literally translates care into currency, and the databases that track diseases over a patient's entire lifetime. It's going to be a great ride.
Here is our roadmap for This Explainer. We're starting big with the digital healthcare shift. Then we'll meet the evolving professionals managing all this data. After that, we'll dive into the daily software, from releasing records safely to billing encoders, and finally, those long-term cancer and trauma registries.
Okay, kicking things off with Section 1, the digital healthcare shift, moving from paper to pixels.
You know, the entire culture of health information management has completely transformed as those old physical paper records became obsolete. Today, it is absolutely vital for HIM professionals to position themselves as the central players in the electronic health record, or EHR. And why is that? Because the traditional legal health record is now fully electronic. If these professionals aren't the ones leading the transition and constantly evaluating these systems, healthcare providers are risking severe HIPAA violations, massive state licensing problems, and serious lawsuits. They are literally the final line of defense for data quality and security.
Moving right along to Section 2, the evolving HIM professional. We're talking about the data custodians.
These are the highly specialized data custodians navigating this crazy digital landscape. And the profession has evolved way past those traditional roles, like your standard systems analyst or basic tech support. Today, we're seeing really dynamic contemporary roles. Think of a chief clinical informatics officer who works side by side with physicians to improve patient care through technology. Or, check this out, the role of a mapping specialist. This person acts almost like a bilingual translator. For example, they write the rules that translate older ICD-9 diagnosis codes, say code 486 for pneumonia, into our modern ICD-10 systems. They have to be absolute experts in both vocabularies so the data maps perfectly without losing a drop of its clinical meaning.
Now, you might be thinking this is all just sitting behind a screen crunching numbers, but despite the heavy technical focus, human empathy, communication, and critical thinking remain absolutely vital. Why? Well, because healthcare is a deeply collaborative environment. An HIM professional has to use empathy to truly appreciate the different emotions and socioeconomic backgrounds of the patients behind the data. Plus, they need serious creative thinking to find innovative solutions when they're collaborating with diverse clinical teams.
Let's hit Section 3, releasing health records safely, also known as the ROI gateway.
We're zooming in on our first critical piece of software here. Every single day, hospitals get bombarded with requests for records. And I promise you, it's not as simple as just hitting print. The typical disclosure of health information process is a highly rigorous decision tree. Actually, scratch that. It's more like a gauntlet. Staff have to enter the request into the software, verify the patient is actually in the master index, ensure the content meets strict hospital policies, check for bulletproof proof of authorization, and verify the requester's identity. Only after successfully navigating all of that can the health record actually be retrieved and securely copied.
And to keep this whole process airtight, these disclosure systems track incredibly granular data. I'm talking about logging everything, from the specific type of requester to the exact date the action was taken, down to the specific documents that were sent out. The big takeaway here is that this tracking is not optional. It is strictly required by HIPAA. Covered entities must be able to provide a patient with a full accounting of their disclosures, and the law mandates that this information be available to the patient for a minimum of 3 years. It's a massive undertaking.
All right, Section 4, encoders, groupers, and billing. This is where we translate care into currency.
Let's see how all this feeds into the financial engine of the hospital. To get reimbursed, healthcare organizations have to assign standard diagnosis and procedure codes to every single patient encounter. Coders use a specialty software called an encoder, which is kind of like a super smart search engine. In step 1, a coder types in just a partial word, like PNU. Then step 2 kicks in. The rules-based encoder immediately prompts them for specificity, asking, wait, do you mean pneumonia or pneumonitis? Once they select the right code, step 3 happens. A completely separate program called a grouper grabs those codes and assigns them to a diagnosis-related group, or DRG. And that DRG? That directly dictates the exact amount of reimbursement the hospital is owed by the insurance company.
But hey, humans make mistakes, right? Which is exactly why these systems have built-in clinical guardrails. The assigned codes must be validated through tools like the Medicare Code Editor. These validation edits are designed to catch illogical, flat-out impossible errors before a claim ever leaves the building. For instance, the software will immediately flag and block a coder if they accidentally assign a newborn code to a full-grown adult. Or there is no way it's going to let someone assign a hysterectomy procedure code to a male patient. It vastly improves the quality of the code assignment and totally protects the hospital's revenue cycle.
Moving to our final section, Section 5, Cancer and Trauma Registries, the long-term data detectives.
If billing software captures a quick snapshot of a hospital visit, registries are the whole movie. They are population-based databases that track very specific conditions over a long period of time. Bridging the gap from textbook theory to real-world impact, registrars use incredibly complex interfaces to enter vital data. Think about TNM staging for tumors, tracking the tumor, nodes, and metastasis. They're logging the grade of the neoplasm, the exact size of the mass. Once all of that is verified, the software automatically generates and transmits these programmed reports straight to statewide cancer registries housed in the Department of Health.
Now, trauma registries work in a similar way, but they are collecting a vast, rapid-fire array of situational data. They record the site of the injury, exactly how it went down, what safety equipment was or wasn't used, and the exact emergency department arrival time. They use this unique abbreviated injury scale, or AIS, to describe the severity of the injury, which then calculates into a final injury severity score. And this is mind-blowing. This data is literally used to predict a patient's required level of care and their actual chances of survival.
So, what does this all mean for us? What you absolutely should take away from this is that registries are not just dusty, dry, administrative databases sitting on a server somewhere. They are dynamic, vital, life-saving tools. By tracking epidemiology at both a state and national level, this data is continuously analyzed to spot trends, improve treatment protocols, and ultimately improve nationwide healthcare outcomes for all future patients.
Which brings us to the end of our explainer. I want to leave you with one final thought. Behind every single diagnosis, every hospital stay, and every minor procedure, there is a massive, permanent data trail. It's a trail that dictates your medical history, your insurance coverage, and even the future of public health. So the next time you walk out of a hospital's sliding doors, ask yourself, who is guarding your data? Well, hopefully, you now know it's the highly skilled, empathetic, and incredibly detail-oriented professionals in health information management. Thanks so much for joining me on this deep dive.